Thank you for joining us for Practice Advantage Pearls. We're delighted to have with us today Paul Louiselle, the Executive Director of Pediatric Surgical Associates in Minneapolis, Minnesota, a busy practice comprised of pediatric surgeons and urologists. So Paul, as we know, implementing a new EMR, upgrading to another electronic medical record, or transitioning between electronic medical records can be a time-consuming, resource-consuming, and also challenging time for any medical practice. Much like getting your Me phone, your Me Pad, or your MC ready, you need to take care of things like security. You need to make sure it's optimized for your function, it's personalized, you've got your contacts built into it. And on a much more grandiose scale, getting the EMR ready to go requires a lot of resources. What pearls or what critical success factors might you share with us about making this a success?
Certainly the most important factor for us was choosing the right implementation team. Having the right members of your clinic participate from the very beginning to the very end of the process was key for us. And we had decided to include staff from basically every vantage of our group, from front desk staff to business office staff to nursing supervisors to a physician representative. And each one of those individuals had certain specific accountabilities in the process. It's key that these people have a focus on process improvement and a deep understanding of current workflows in your organization so that when the transition begins, they can effectively relate that to a new system. It's also key that these individuals are respected within the organization. They don't necessarily have to be managers within their different areas, but they do have to have the respect of their peers. One other variable that's important for us, or was important for us, is that we kept pace with the various tasks that were designed throughout the process. Once you begin your implementation process, your EMR group, whoever you've selected, will come forth with a specific list of duties that have to be completed at various points in times in order for you to meet your anticipated go-live date. One of the challenges that we faced was keeping on task with that, given the other responsibilities that everybody else has throughout their day, trying to maintain the pace of the implementation task list was a challenge. So what that means practically is maybe providing support to the people that are on your team to help them disengage a little bit from their normal duties to allow them time to focus on EMR implementation. Then the last variable that we found was key to our success was, and this was slightly underestimated by my part, was the degree to which your IT person is key to engage from the very beginning. From the selection of the EMR tool to selection of devices that are used by your physicians in the exam room, to making sure that your data pipeline is large enough to make sure that the response time that you have throughout your day is effectively large enough and capable enough to handle the number of people on your system. So those are three key areas that we would say are probably the high points in our EMR success.